Welcome to the Pharma Voice 100 one-on-one video series with Karen Groen.
Hi, Georgia. It's so good to see you. Thank you so much for joining us for the Pharma Voice 24-hour celebration marathon.
Thank you so much for having me, Tara. It's always a pleasure to see you, and thank you for giving me the opportunity once again to engage with the Pharma Voice audience.
You're so welcome. Let's talk about engagement. I know you are a global expert in digital technology, which is leading the way in engagement across the industry right now. How do you believe technology can transform the way we deliver care and its quality?
I think it's an interesting question to ask, Taryn, specifically in the times that we're living in. You and I, we had the opportunity in the past few years to discuss and explore the value of technology as a medium that provides stronger engagement with patients, doctors, and practically we were trying to make a case for something that seems so logical. But we couldn't necessarily persuade, I would say, lots of people. There was still lots of skepticism. But here we are, and within the last 5 months, due to the unfortunate event of a pandemic, it feels to me that the world just transformed. Not overnight, but if you think that these technologies have been around for many, many years, it feels to me like it has been transformed overnight. So unfortunately, when people have actually been pushed against the wall and they have left with no other option, a magical thing happens in a way, and everything that is kind of felt very maybe new and unknown and fear was involved for them to make some decisions. Right now, there is no other choice but to use these technology and have the opportunity to engage in times of need.
Agreed. So as we look forward, where do you see us going?
Oh, first of all, I think that, of course, I hate kind of repeating the same terminology, but for the sake of keeping everybody on the same page, I think that we're heading to our new normal. I believe that people talking about the patients and the healthcare providers, they have realized the most important thing that I have been advocated for many, many years. Since I have started getting involved in the digital health space, I have recognized the importance of convenience more than anything else, more than the quality of data, the additional data sources that some of these technologies could provide, the real-time monitoring. The most important factor that people will actually use it is convenience. And now we have all experienced that, how easy it is to connect with your healthcare provider, with the online communities, and keep going or keep living somehow a normal life under these weird circumstances. So even when the world goes back to its normal rhythm, which I'm hoping to happen sometime soon for the sake of everybody's mental health, I do believe that these technologies have really positioned themselves as useful and convenient, and people will continue using them more and more. Just because it saves time, just because it makes the interaction good enough, and I don't exactly see which elements are we missing from the face-to-face interaction that a screen cannot actually substitute. So here we are. Of course, I would have preferred to be in the same room with you and look at you and your beautiful smile, but we have the opportunity to connect via screen, and it was easier for both of us because we didn't have to travel and lose all that time. So it works well.
That's true. And finally, and quickly, if you don't mind, I also know you're an advocate for advancing women in the life sciences. Why is it important to have greater diversity among leadership?
I would say, why not?
I agree.
It feels the right thing to do. I mean, women represent 50%, 51% actually of the world's health population. More and more women are now engaging in the health science space, and First of all, as a woman and as a mother of a young daughter, I will always advocate for more opportunities for women. I think that we're still struggling to have some equal representation from women and other minorities in the pharmaceutical industry. We do struggle to have diversity in clinical trials. So I think that there is a lot of work that needs to be done. And I will try to stay away from, some stereotypical facts that actually there is data that shows that the more women that you have on board and the more equally your board is being equipped, you can see the positive effects in the bottom line. The diversity, it helps everybody, in my opinion, to continue working on becoming better people. If you have people of the same with the same mindset as you do not have any opportunity in becoming better. And who doesn't want to become better? It's all about growth and curiosity. So I will continue being a strong advocate of women and diversity in general.
Excellent. Georgia, so good to see you. Thank you so much for being part of our celebration.
Of course. Thank you so much again for having me, and wishing you all the best for this year's celebration and for many, many years to come.
For more PharmaVoice 100 content, visit www.pharmavoice100.com.